How do junctional arrhythmias affect the heart and overall physical health, and what effects, if any? In this video, I will explain how junctional arrhythmias occur, the steps and methods to identifying junctional arrhythmias, and the various types of junctional arrhythmias that affect patients today. Afterward, I will briefly review the physiology of junctional arrhythmias and the issues society faces with regulating arrhythmias. Arrhythmias are irregular heartbeats, whether the heartbeat is too fast, too slow, or a different rhythm than the usual sinus rhythm. Before going into what junctional arrhythmias look like, I'll show you what a normal EKG is supposed to look like for comparison. Normal sinus rhythms are identified by having a positively deflected P wave, round in shape and amplitude less than 2.5 millimeters in a duration of less than 3 small squares, or 0.12 seconds. The QRS complex is usually positively deflected and narrow. The PR and QRS interval would generally be less than 5 small squares, or 0.2 seconds. An average heart rate would be around 60 to 100 beats per minute. On the other hand, junctional arrhythmias on the EKG show absent or inverted P waves. 40 to 60 beats per minute is a typical junctional pacemaker heart rate. The rhythm is still regular, but the PR and QRS intervals are less than 3 small squares instead, or 0.12 seconds. Junctional arrhythmias are a type of arrhythmia that are irregular heartbeats caused by the failure of the sinoatrial node. The sinoatrial node fails to fire when you have a junctional arrhythmia. Instead, the atrioventricular node takes over the second pacemaker to fire electrical signals. It is a benign arrhythmia. If no symptoms or disease are shown, treatment is unnecessary. For the ELA component, we discussed the background and physiology of junctional arrhythmias and their effect on health. To test for junctional dysrhythmias, your provider may use an EKG or electrocardiogram to check the heart's rhythm and electrical activity. It is a non-invasive and simple test. Patients with junctional rhythm may present with a varied array of symptoms or may be asymptomatic. Symptoms mainly depend on the underlying cause of junctional rhythm. For instance, a patient presenting with heart failure exacerbation may be present with shortness of breath, wheezing, and lower extremity edema. Patients with rheumatic fever may present with a heart murmur secondary to damage to heart valves, fever, joint pain, and a rash, with an electrocardiogram showing a junctional rhythm. Some patients might present with generalized complaints such as dizziness, fatigue, syncope, presyncope, and intermittent palpitations. Non-specific physical exam findings conclude pulsating veins and regular heart rate, varying from 20 to over 100 beats per minute. For our social studies component, we talked about public and personal issues facing the regulation of arrhythmias. Patients with arrhythmias may experience complete or partial loss of consciousness. Questions regarding patient concern or privacy, regulation, treatment, and activities arise every day. Is it safe for the patient to stay in that state? What do healthcare professionals do to help that patient despite losing consciousness? The most common question concerns the visibility of driving because the safety of both patients and others may be threatened when personal or professional activities are performed by persons with arrhythmias that impair consciousness. Given the magnitude of this problem, the American Heart Association and the North American Society of Pacing and Electrophysiology co-sponsored 2 conferences on medical and regulatory issues related to arrhythmias in the context of driving and other activities. The first conference, Driving and Arrhythmias Medical Aspects, was held at NASPA Scientific Session. The second conference, Personal and Public Safety Issues Related to Arrhythmias That May Affect Consciousness, Implications for Regulation, and Physician Recommendations. The second conference had a broader focus and addressed regulatory and legal issues related to activities in patients with arrhythmias that may result in impaired consciousness. There are risks to both personal and public safety when patients with arrhythmias that may impair a consciousness drive or perform public service functions, such as commercial driving and commercial or military flying. Thus, the efficacy of treatment and implications of arrhythmia risk recurrence is significant, regardless of the treatment approach, whether by drug, device, surgery, or catheterization. Those with arrhythmias mustn't leave their health unchecked, as the symptoms and effects of irregular heartbeats can worsen and affect their daily lives. Thank you for listening, Harmony School of Advancement.